Educational GMAT. Your partner in your GMAT journey.
So what I'm not doing is I'm not right now displaying the 5 answer choices for a reason. Because I don't want you to get lost in those answer choices. Your first sequence has to be in getting clarity about the argument and what the question is talking about. So the question obviously is talking about strengthen the argument because that's the topic that we have for the class today. But in the actual exam, you should go through the question statement first so that you know what the question is talking about or is expecting. Only then you should go through the argument. All right. Please go through it and then let's discuss. Done reading. Now, what would be our first task? Very nice. Identify the conclusion. And here conclusion is served to you on a platter. How is it served to you on a platter? The word therefore, right? So this is the conclusion. Reinfection will probably be less common in cases where the new antibiotic is prescribed than in cases where either penicillin or erythromycin is prescribed. Okay. These are the answer choices. Now, mind you, among the answer choices, you have to always choose an answer choice that most strengthens the conclusion. The most strengthens the conclusion.
Where is it D?
All right. So Rajiv is going for David, D. Do you guys agree? David, what do you guys think? Yes, friends. Those people who are online, you see a chat window in front of you. As I requested, please don't type anything on the chat window because I cannot see the chat window. Please speak up. Yes. And don't worry, big deal if you get it wrong, guys. Big deal if you get it wrong. Just give your best shot. Yes. Sorry.
C.
Charlie. Okay. All right. Charlie, David, or some other option? David? All right. Okay. Charlie, David, Edward. Yes. What do you guys think? Charlie, David, Edward. Okay. As I often do, I've drawn a table so that there is better understanding. Traditional antibiotic was supposed to be a 7-day treatment, but most patients took it for how many days? 3 days. So was there a reinfection? Yes. Now, this is my question to you. This is perhaps the most relevant question. If the doctor is prescribing a 7-day medication, why would patients stop it after 3 days? Sorry? That's the only explanation, that they feel better. Absolutely. So patients feel better after 3 days, so they believe they are cured. Well, they feel better in the sense that symptoms go away, but the infection is still there. And because they prematurely stop the medicine, the infection comes back. Right? That's pretty much the only explanation. All right. New antibiotic is supposed to be how many day treatment? See, let us say patients start taking the new antibiotic and feel better after 2 days. What will they do? They'll stop the medicine. That's what they did here as well. They'll stop the medicine. Will there be a reinfection in this case? Absolutely. So the situation is no better. Similarly, the new antibiotic is supposed to be a 3-day treatment. Let's say patients start feeling better after 2.5 days. Again, what would they do? Stop taking the drug after 2.5 days. Will there be reinfection again? Yes. But with the new antibiotic, are they expecting reinfections? No. Now, when will there not be reinfections? When patients take it for 3 days. But then going by the history, when will they take it for 3 days? When they feel better, only after 3 days. And that's exactly what Edward says. Regardless of whether they take a traditional antibiotic or the new one, most patients feel better after taking the drug for 3 days. Because as we discussed through this table, if they feel better after 2 days or 2.5 days, then they would stop taking the drug prematurely, in which case the situation would be the same as it was with the traditional antibiotic. Are we clear? Okay, let's quickly look at the other options as well. And why is alpha incorrect, by the way? Sorry. Okay, unrelated. And by the way, the word some. I did mention at least a soft indication that this might not be correct. Similarly, some here. Not definitive, but at least some indication. Now, who are allergic to penicillin are likely to be allergic to the new antibiotic. Now, this is again something that I have been mentioning in critical reasoning very, very clearly, that you need to keep the comparison in mind. What is the comparison here between penicillin and the new antibiotic? That new antibiotic is basically more effective. But then alpha does not bring out any comparison differentiator at all. Right? There's nothing to differentiate because some people who are allergic to penicillin are likely to be allergic to the new antibiotic as well. So there's no differentiation coming. Cost would be completely out of scope. Cost is completely out of scope. How about Charlie? Again, I would say it's a bit out of scope because, can someone tell me why is Charlie out of scope? Because what was being compared was the effectiveness of these two medications in treating strep infections. So other infections would be out of scope. David was quite tempting. Some physicians have already begun to prescribe the new antibiotic for the treatment of some strep infections. Well, physicians may prescribe a new antibiotic for a lot of reasons. Perhaps just because, obviously, patients have to take it for a lesser duration. Maybe they are getting a more cut. Maybe the side infections are less. Maybe the costs are less, right? Could be many, many reasons. So this does not, at best, it strengthens the conclusion very marginally. Edward is much more convincing. Clear? Any doubt, guys?